Good morning or good afternoon, everyone, depending on where you're joining us. Thank you for being with us today and welcome to our webinar. Um, Next slide, please. So again, I wanted to welcome you all to our webinar, Approaches to Expand Strengths and Support Challenges as People Age with Serious Mental Health Conditions. This is session 3, part of the Supporting Recovery for People Aging with Serious Mental Health Conditions webinar series. Our center, this webinar is sponsored by the Northeastern Caribbean Mental Health Technology Transfer Center, or MHTTC, and we're housed at Rutgers in the School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy Rivera, and I'm the project coordinator of the center, and I'll be introducing our center today, as well as our webinar presenter. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health workforce to deliver evidence-based and promising practices to individuals with mental health conditions. We also offer training programs on evidence-based practices for serious mental health conditions, wellness and recovery for providers and people with mental health conditions, school mental health, Hispanic and Latinx mental health education, and online education courses such as Wellness Matters, IMR, Functional Thinking, and more. Next slide, please. As a reminder, all of our training programs, products, and services are available to you at no cost. And if you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, we ask that you please sign up to receive our email communications. You can sign up by scanning the QR code that you see on your screen. And then following this webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform our future activities. The surveys are also important because our continued funding is linked to the completion of them. So we thank you in advance for your participation. We also want to let you know that this webinar is being recorded and will be posted to our website within 7 days of this webinar broadcast. At the time of this presentation, Dr. Miriam Delphin-Rittman served as Acting Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS, SAMHSA, for the opinions described in this presentation is intended or should be inferred. We encourage you to interact with our presenters during this webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you, so please use the chat feature to answer them. As a reminder, the MHTTC network is committed to using affirming, respectful, and recovery-oriented language in all of its activities and products. As a reminder, we'd like to share with you the 988 Suicide and Crisis Lifeline. 988 is for people experiencing suicidal ideation, mental health, substance use crisis, emotional distress, or people concerned about someone in crisis. Now let's begin our webinar. We have Dr. Michelle Zechner with us today. Dr. Zechner is invested in promoting health and wellness for all people, but has special expertise in people living with mental health conditions and their supporters. She began her career in gerontology and has clinical experiences in nursing homes, outpatient mental health services, and aging services. She has also consulted extensively in outpatient, inpatient, long-term psychiatric settings. Her research is in health promotion programs for people with mental health conditions and in multidimensional wellness for people aging with mental health conditions. Dr. Zechner currently teaches, conducts research, and is involved in workforce development initiatives for mental health staff and peers. Now we'll turn it over to Dr. Zechner.
Thank you so much. Good morning, everyone. Welcome. Or I'm saying good morning. You may be afternoon where you are. I don't know. But I'm really glad that you're with me today, talking about one of my favorite topics of older adults living with mental health conditions and aging with those conditions. So I'm really grateful that you're here today. We've had two really wonderful seminars in the last 2 weeks. If you haven't been able to catch them, that's okay. They're going to be recorded. They are recorded and they will be put up on our website. So I encourage you to check that out if you're interested. And today we're going to talk a lot about strengths and challenges of people aging with mental health conditions. We know that people have a lot of challenges, but they also bring a lot of strengths, experiences, problem solving, and resilience to each day. And I'm sure you've seen that in the folks that you work with. I've seen that in the folks that I've supported. So this session is going to explore some of those areas. And I want to ask you, I'll be asking you questions via chat, and I encourage you to participate because it's really helpful to sort of engage with one another. I also really encourage, we're going to be talking about the strategies to engage folks and motivate them, which can be a big challenge. And we're going to discuss some strategies to build resources and social supports. So with that being said, let's get going here. If you've attended these in the past, I'd love to know who you are. So if you would put your first name, your role, and your state in the chat, I'd really love that. It helps me. I know we've had people from the West Coast, from the Midwest, from the East Coast. I love to know where you're from and your role. We've had, in this series, it's been great. We've had some peer providers. We've had people in forensic services. We've had people in aging services. We've had people in mental health. So I really love to see where you're coming in from. I see someone from Indiana. I love Indianapolis. It's one of my favorite places. Also Utah. Oh, wow. Wonderful. And Chicago. Oh, wonderful. And Seattle. Lovely. And Florida, Maryland, New Jersey. Wonderful. And Ohio, California, Puerto Rico. Hola. It's so nice to see you here. Oklahoma's back in the house. Pennsylvania. Very nice. I worked in Pittsburgh for a while, so it's nice to see folks there. Brooklyn, wonderful. Arizona, Newark. Oh, wonderful. Well, and Illinois, where I was born. Wonderful. Well, welcome everyone. And we've got folks again from Ohio and Seattle. Lovely. Well, welcome. I'm so glad you're here today. And I'm really excited about this topic. And I hope that you share my enthusiasm with me. Okay, so I'm having a little trouble going forward, and I apologize for that. It's going to be like a Monday on a Thursday, but anyway, bear with me as my mouse gets hiccups on the forward and the reverse. So the last two sessions, I'm not going to talk about the first session. I just want to do a quick review of what we talked about last week. I see some familiar names and names and places. So this may be a quick review. You maybe weren't able to attend last time, which is fine, but I want to just sort of let you know to kind of set the stage for today. So we talked about healthy aging, right? And that's the idea in gerontology that aging actually begins when we're born. We begin aging the moment that we're born. Every action and decision we make has some impact on how we age. So things like being physically active or moving and not being too sedentary really likely helps to keep our brain and our body in good working order. However, there are things that we can do and choices we make. Not I say we, I mean every human being. Things like drinking heavily or using substances. Likely that's not very helpful to our brain as we get older or to the aging process. So it's helpful to take that bigger perspective that aging begins from the moment that we're born. We talked a lot about psychiatric rehabilitation, which is my field and something that I feel very passionate about. And that's the idea that people can and do get better and recover from serious mental health conditions. Psychiatric rehabilitation focuses on recovery, on community integration, and empowering a person to live a good life. And I imagine that many of us do that in our different roles and our different ways. And we did talk about shared decision making last time, and I gave you some examples and tools. And I'll talk briefly about it today. So definitely shared decision making is an excellent way to engage people. Some specific examples of psychiatric rehabilitation, best practices, and some that have some evidence and research behind them are things like skills training, self-management, integrated physical and mental health services, and the peer-delivered services. We also need to be aware that, and you are probably already using some of those programs for older adults that may have some utility for people aging with mental health conditions. And that's things like transportation services, meal services, um, and other types of things that you might find through the Area Agency on Aging. So let's start off today by talking about the strengths and challenges of people aging with mental health conditions. It's really important to consider a person's well-being and their wellness in different areas, because that kind of will lead us into what strengths and challenges they may have or may not have. So thinking about strengths and challenges can really be led by thinking about this idea of multidimensional wellness or comprehensive wellness across different dimensions. So I've spent a lot of time with this. I always joke that, I have spent, years working on manuscripts, thinking about wellness models for older adults living with mental health conditions. So it's something I spent a lot of time with. So my team and we started thinking about wellness for people aging with mental health conditions. And we thought, it's probably a little bit different than multidimensional wellness in other ways, but we put it in context. So we sort of said, there's probably different levels of well-being and strengths and challenges. And some of it comes from community and society, the broadest sense of things that are really external to the person. It also is sort of dependent on the strengths and challenges that they may have from resources and supports, or those things that help the person be who they want to be and manage what they need to manage and live the best life they want. And then there are actions, which we're not really going to talk too much about today, at the individual wellness level, where the person can take steps towards their own wellness and well-being. Now, this model that my team and I thought about, it really was based off of Dr. Peggy Swarbrick's work, who her multidimensional wellness model has been adapted by SAMHSA and promoted on their website. It's a great, overlapping sense of how we can build our health and wellness in all different areas of our life. And I think that it's helpful to think about assessing how people's strengths and challenges in each of these areas may sort of guide some of our interventions. We worked, Dr. Swarbrick and I, and then we had a colleague from Virginia Tech, Dr. Matt Fullen, who thinks a lot about wellness for older adults. And we met regularly for about 2 years to consider this idea. So anyway, I'm citing myself. It feels a little weird, but on the other hand, it was pretty exciting work to do, because not a lot of people are thinking about this population. I'm grateful you're here, but we know that there aren't a lot of thought leaders in the area of health and wellness and rehabilitation and recovery for people aging with mental health conditions. So let's start at the community and society level. I think at the broadest level, we can think about what is the community and societal view of aging, right? In your communities, in the broader media, what messages do we get about that? And what are the thoughts about mental health or people living with long-term mental health conditions? What are some policies that support or challenge life? And what are the types of programs that are regularly offered? So we thought about a couple of ways to conceptualize at the biggest level. How do we think about the strengths and challenges at community and societal level? So let's think about attitudes. There's an idea in gerontology called age-friendly communities, where housing, it meets the needs of the person. So there's grab bars for everyone. If they need them or they don't need them, it's there. There may be more transportation. There may be better seating available at bus stops. How to make a community that is more inclusive of everyone, regardless of needs. Also, systems that are person-centered care. Those attitudes of, we're going to meet people where they're at, and we're going to try to find services that fit where they need. And I know from the last 2 sessions that many of you have attended, that you all are doing that level of person-centered care, trying to find services in mental health programs, but also in aging programs that fit the needs for the person. And having policies can support overall wellness and well-being for people living with mental health conditions. And that's things like flexible age requirements for aging services or mental health services. And there's a lot of pushback in that area. You may be familiar with it as well, at least in my systems that I've run into in New Jersey and Pennsylvania. You may have to be a certain age in order to receive an aging program. And on the other hand, I've seen this, unfortunately, if you are a certain age, you may age out of mental health programs or behavioral health programs, substance use programs. So really rethinking that age limit and how that is helpful or not helpful to a person who is living and aging with mental health conditions. Also placing a priority on aging in place over institutionalization. So people may be living in specialized housing for mental health conditions, but they may not really understand the needs of older people. They may not understand the needs, the mobility issues that come up, and how can we help people stay in the place that they prefer. Also, reimbursement rates really need to match some of the needs of our population, right? And that would be things like they may need a little extra time. They need more frequent visits. The people who are aging with mental health conditions, they have a lot of health needs and health issues, and I'm sure you've seen that. And they cost the insurance system quite a lot. How can we not only reduce costs, because I know that's a big driver in our system in terms of policy, but also how can we improve people's quality of life so that they're not ending up in the emergency room with medical conditions? So what do you see from your perspectives about people who are aging with mental health conditions at the community and society level? What are some strengths that you might see for people living with mental health conditions? One strength I've seen recently is a greater emphasis on integrated services. So mental health and physical health services being co-located in one area. I'm curious if you see any other strengths. Okay, and people are saying it's a little bit different depending on the diagnosis. Okay. Any challenges? Strengths are hard, I know, because we are often, as providers, we're focused on what is the problem and how can we focus on the problem. But I see caregiver support groups. Oh, thank you. That's a really great example of something that can support people who are aging with mental health conditions at a community and society level. It's caregiver support groups and mutual support for chronic conditions. Like, I don't know if any of you have heard of Kate Lorig's chronic disease self-management models, and those are helpful for people who have things like Parkinson's disease or cancer or other medical conditions. Oh, nice. Okay, so more advertising could be helpful as a strength because it might normalize aging and promote more discussion. Thank you. That's a great suggestion as well. So there are some ways that we can support people who are aging with mental health conditions at the community and the society level. But let's talk now in an area that we're probably more comfortable with, I'm saying more we, and I think I mean me. And those are the resources and supports. And those are the paid and unpaid supports that help a person succeed and have a good sense of well-being and wellness. And they can come at different levels. It can come from the community perspective. And it's a little bit of an overlap between community and society, and also the resources and supports. So there's a little bit of an overlap. But the community of things would include things like cultural supports, roommates, building staff, faith community, barbershop, hairdressers, whoever a person sort of considers as their community. It can also include supports from good friends, family members, mutual support groups, or peers. And then I mentioned neighborhoods as well. I mean, that's really, really valuable. That can really support people who are aging with mental health conditions. Things like bus stops that are carefully thought out in terms of nearby housing, but also nearby shops or medical providers, senior centers. And I know that some of you have told me in the last sessions that you don't have access to senior centers because of being very rural or in a very, kind of remote location. And then thinking about how we might make that a strength in terms of what options does the person have for telehealth or for online senior centers. I mean, I know that some of the senior center providers were offering services online during the pandemic. And I also know that some of the adult day services that are offered through aging programs that for people who have medical conditions or dementia also do some things online. Of course, that means a person has to have internet, they have to have some kind of device, and they may need some support to get online. So that may be a strength or it may be a challenge. Also, health literacy can really support someone who's aging with a mental health condition. Knowledge is so important for our health. If we consider it, think about a recent health condition that either you had or someone that you work with had. You want to know what that diagnosis means, how it's treated, what the prognosis is, what are the medications, and any lifestyle changes that you might need to make in order to stay healthy. And that's an area that many people with mental health conditions struggle with. And it's pretty complicated, health literacy, but it's important that we keep sort of bringing that up because the more people know, the more of a strength that is. And I think that in mental health, we're getting so much better at that. But I can remember, I'm not going to share my age, but I can remember starting out and working with some psychiatrists at a long-term psychiatric hospital. And they were saying, well, we never discuss diagnoses with our patients because that could upset them. And I think that in psychiatric rehabilitation, we want people to have that knowledge. We want people to be empowered. And it's considered a best practice in order to manage one's healthcare if one knows what your diagnosis is or what my diagnosis is. And I think that's less of a problem than it used to be, but it still may be sort of something that comes up. Also, transportation is definitely a critical determinant of health, and it is a resource or a support that people can get to the doctor, that they can get to the grocery store, that they can also get out and have some fun, go bowling, go to the library if they prefer, whatever, meet a friend. So transportation is really critical. And I know it's a problem in many places that does not, believe it or not, in New Jersey, although it has good transportation in the northern part of the state, the southern part of the state is more rural. And across the United States, I know that transportation continues to be an issue for people who don't drive, who may have mobility issues. And then we want to talk about the access to resources that help people live comfortably. One estimation is that about 25% of people living with mental health conditions live in poverty, with people of color experiencing even greater poverty. So we know that having enough funds is critical to having enough to eat, to having a roof over your head and a little extra in your pocket so that you can live the life that you want to live. So what are some of the strengths that you consider that people aging with mental health conditions might have in the area of resources and supports? Someone else has commented in the chat. I welcome you to put some of those thoughts in the chat. I know I'm asking you for some big thinking and it may be early on the West Coast, but can you think of any ways that people aging with mental health conditions have strengths in the area of resources and supports? I will say, for example, from a community perspective, many communities are pretty supportive of folks. And folks may be involved in self-management groups, in wellness or self-help centers. Those are great sources of support. Transportation, we have some programs that may be a strength and some coordination. If you're working with clients, you may have access to resources that help that person with transportation. I see some comments here that multidisciplinary clinics are really, really great because they offer a number of resources. Thank you. And yeah, I see that you're talking about homelessness is a problem, and definitely noticing that people are resilient and that they're surviving, and trying to help people do that. And seniors know other seniors, so definitely the strengths would be sort of connecting with our peers. Recovery centers or self-help centers or wellness centers, they have different names in different states, are great spaces for community and relationship building and health literacy. Wonderful. Also, senior centers fall in that group, I would say. People are saying that, I think another good comment here, resilience and knowledge of the community in my clients. That's great. They know better than me what buses to take. Absolutely. So people can be great resources to one another. And that's really the value, I think, of peer support and mutual support, because often when it's someone who's has that same lived experience, it's pretty powerful. Also, having good communities in Florida and kindness, absolutely. And then thank you. Susanna's just like, you know what, let's just go to the challenges, because there are a lot of challenges. I know that. To even get some support from Medicare. And Medicare is a problem. And I think that also falls in the community and society issue, is that Medicare isn't great at mental health care coverage. So if someone is Medicare only, they may have less access to mental health care. Whereas people have Medicaid, then they're much more likely to access different resources in a state. So I think that is something that an advocacy level, which we'll talk about a little bit later, is something that we have to think about. Caregiver centers and caregiver state plans, wonderful. Absolutely. I do some work with an organization with Rutgers UBHC COPSA, and they have a peer-to-peer caregiver hotline, which is wonderful. And I've talked with those folks. They're really wonderful. And then sort of that siloed approach to resources, again, is so frustrating for all of us that it doesn't serve the needs of the people that we are engaging. Great ideas, everybody. Thank you for sharing. And then lastly, we get to the multidimensional individual wellness. I see a question, can anyone access peer-to-peer services? If you're asking about the peer-to-peer caregiver, oh, yes, let me put that. I will put that. Yes, I will put the name to it. It's called Care to Caregiver through COPSA, but I'm sorry, I'm not good at typing and talking. You can Google that. I don't have the number in front of me, obviously, but definitely Google it. Anyone can access it. It's been funded through the state of New Jersey, but anyone can access and anyone can call that number. And it's pretty awesome because the caregivers there are really amazing and they're really focused on the health and wellness of the caregivers. So let's talk about multidimensional individual wellness. And I bet that many of us are familiar with this these models of multidimensional wellness, and how do we help people age well and what strengths do they have. The model that so as I mentioned, I got to spend a lot of time with my amazing peers and colleagues thinking about this, but we included this idea of developmental wellness. Perceptions about aging, about ourselves as we age, because I don't know about you all, but I've seen this in the clients and service recipients that I've worked with, that people don't believe that they can make changes. They have a lot of self-stigma, a lot of ageism about themselves and what they can accomplish. So when we're thinking about the strengths and challenges of people, we want to make sure we want to understand what their perceptions about aging are, and to make sure that we might be able to support that. Another area of that is spiritual wellness, and that's really that connection to purpose and meaning and something beyond ourselves. And as I've said in some of the previous sessions, this is an area that's extremely underrepresented in mental health care for older adults. And I think it's something that we need to continually look at, because that meaning and purpose may really cause people who've been in the mental health system a long time to struggle and to feel depressed and to feel withdrawn from society. Additionally, emotional well-being, thinking about emotional balance and navigating symptoms. What we know about people as they get older is a lot of the things like thought disorders calm down a little bit. But what happens as we get older is that we may become a little more withdrawn, a little less able to enjoy life and connect. And that may look like depression, or it may actually become depression. So that emotional well-being is a challenge or an opportunity or a strength for other people. Also, physical health, accessing care, managing those chronic health conditions. And then cognitive well-being, which is sometimes referred to as intellectual. And for older adults who've living with mental health conditions, I think that's really about brain health. It's really the strategies to maintain focus and attention, and actions to preserve memory or stave off additional challenges. Occupational, and I love this area as well for older adults, because it's really, what do I get up and do each day with myself? It's not necessarily a job. It may be, or it may be volunteering, or it may just be like, my grandmother always said, Monday's wash day, Tuesday's ironing, Wednesday's groceries, Thursday's cleaning. She had a structure. I mean, she's still alive at 98, so that structure kind of lingers. And it's important to all of us to have a reason to get up every day. And I think that a lot of our clients sometimes struggle with that. The social connections are really also vital to maintaining good physical health, because there's a lot of evidence that our social connections protect us and support us from getting sick, from staying sick, and also being able to get back, bounce back faster. And our social connections are really vital for our brain health. Loneliness and isolation is really hard on the brain, actually. Our financial well-being, which I think is pretty clear, and environmental, which is that positive and supporting physical space that's tailored to our own needs, whatever those might be: mobility, vision or hearing issues, or maybe lots of color and access to blue sky, and plants and trees. So let's continue on. I'd love to hear from you all. Looking at this list that we just raced through, what are some of the dimensions that you see as strengths in your clients? Like, if you had to say, what's the one area that might be a bigger strength, what might that be? I might say that, someone says spiritual. Oh, great. Two people say spiritual. That's amazing. That's very cool. Okay. Those are strengths. I also would say emotional strength, because folks have coped and adapted and been resilient for many years living with a mental health condition. So I think that's another area of strength that I have seen in people aging with mental health conditions. Yes, people asking for help. Oh, that's really wonderful. Like being curious, and wanting to learn more. That's, sort of a uh, occupational or cognitive wellness, I guess, is being open to learning new things and being flexible in your thinking. Thank you, everybody. Some examples of strengths that don't necessarily fall exactly in those particular boxes would be things like coping. People have been amazing at coping with experiences of discrimination and stigma and ageism, and navigating through distressing thoughts and feelings and times, and maybe interactions with mental health providers. We don't know. Resilience, because I just want to circle back to that a moment. Mental health care has changed a lot in the last 40 years. So people who are older adults right now may have had a different experience in the mental health system than people who are younger adults. So we need to also sort of acknowledge and be aware of the history that people might be coming from. And we see this resilience of bouncing back from difficulties, experiencing, I love this word, Richard Tedeschi from the University of North Carolina talks about post-traumatic growth, which means that we learn and grow and we lean into our sense of purpose and meaning and spiritual development after difficult things that occur. I see a lot of resilience in people that I work with, and you may have seen that as well. Perspective. And that also, I think that comes from living life and also from aging. You can kind of get a long sense of, the things that bother me now certainly are things that wouldn't, or things that bothered me, I guess I should say it the other way. Things that bothered me 20 or 30 years ago are not the things that bother me right now. I have a better perspective. I know that things are difficult. During difficult times, I can manage that stress. I can keep going forward. And I think that a lot of our clients are in that space too. And we can remind them of their resilience and the times that they've succeeded. Yes, and I think this sense of grief and loss, that's a really good point. And sometimes a survivor guilt. So if someone is aging with a mental health condition and they're in their 60s, and I've had the great opportunity to work with the Academy of Peer Services in New York State. I've done some stuff with their peers thinking about older adults. They talk about that, like, why am I still sort of around and my friends have all died prematurely and younger, and they're in terrible shape. And I think that that's also part of what we have to address and get better at, is thinking about grief and loss and transitions, which is honestly part of the normal aging process, is grief and transition and losses. And it may be worse or it may be better for people aging with mental health conditions, or we just maybe need to talk to them about what their thoughts about that are, because we want people to also they may have a greater sense of knowing who they are at this point, and they may have that spiritual well-being and wellness that's really, like, they know what the sense of meaning and purpose in their lives are. Also, having this positive lifestyle is something that is a strength for people aging with mental health conditions. They've sort of managed some difficult things for a long time, so they know what works for them. People may have stopped drinking or using substances. They may understand or know that eating a lot of sugar isn't great for their diabetes, so they decide to make some lifestyle changes, or having some kind of movement every day. And then knowledge about how to navigate systems. You put that in the chat. That was a really great example of peers helping peers, of like, what's the best bus system? Where can you get the most, the best grocery store? Where can you stretch your dollar? Is there a senior day where you can get a discount? Also, neighborhoods, knowing, which neighborhoods are the areas that people want to hang out with, or that are safer or more comfortable, and how to maintain those health issues over time. Any other examples of strengths that you can think of now that I've opened up the strength door? It takes a little reframing, right? I don't know if any of you have ever taught illness management and recovery, but I facilitated illness management and recovery in the community, and then in inpatient settings with middle-aged and older adults. I learned so much about people's strengths and how to reframe some of the challenges that they brought, but also the amazing strengths that they brought to the situation. So let's have a little case example here. This is Sylvia. Sylvia is 57 and she lives in a senior high-rise apartment. She manages several health conditions and has lived with depression for more than 30 years. She's fluent in Spanish and English. She walks each day for 15 minutes with a friend. She often jokes that her secret to a good life in the morning, her secret to a good life is the morning walk, because it gets her out of her apartment, moving around, and she can catch up with her friend. So what would you say are some of Sylvia's strengths? You can either use some of the wellness dimensions that we talked about earlier, or your own perspectives. What is Sylvia demonstrating as a person who has a serious mental health condition and is living in the community? That's probably one strength right there. If you just go ahead to your chat, drop in, what do you see as some of the strengths in Sylvia's story? She speaks 2 languages. That's pretty awesome. She exercises and she manages her own health issues. Absolutely. She also has some social connections. The walk includes mental stimulation. That's a great point. She has lots of strengths. She manages her health and depression. Yep. She walks, has friends, humor. Love that. the morning walk and the social support. Excellent, excellent. That's kind of what I came up with as well. And I thought about it because I think so much about wellness. I thought this is physical, emotional, social, environmental. Oh yeah, and resilience. Oh, thank you. And connection to nature. Yeah, that's a great point. And stable housing. Oh, that's great. Yes. And we don't know, but we can assume that she's been out of the hospital or out of, crisis services for a long time. And she's got a good routine and she gets up every day and out of bed and does things. That's wonderful. Wonderful. Thank you, everybody. All right. I have another example because I want to give you two. Marcus is 68 and he identifies as a Black gay man. He's experienced bipolar symptoms and trauma in his younger life, but relishes his role as a musician, an artist, and an advocate for his community. He's been sober for more than 30 years. He actively advocates for others. He's committed to good health through healthy eating and running 5K races and has a long-term partner. He believes his negative life experiences helped him learn to speak up for himself and get his needs met. He often refers to himself as a good troublemaker through his advocacy and thinks of himself as a fighter when he goes through difficult situations. So Marcus is totally kind of a different person and has different strengths. I'd love to hear some of the strengths that you see in Marcus's story. And again, you can either put the wellness dimensions or you can just drop some things that you see about Marcus. Someone put in, he's accepting of his mental illness and his sexuality, music. He uses his experiences to grow, long-term partner, and advocates for himself. Really nice. He sounds educated about his problems and issues. Nice. Resilience and connecting to his community. He's offering something to other people, which is, I think, something that our people aging with mental health conditions want, but they don't always have that opportunity. So it's important to offer opportunities to grow in that. Social, active, vocational, and advocates for others. Yeah, awesome, awesome. So I think you probably see these strengths in the people that you are supporting every day. And sometimes it gets lost and overshadowed by the challenges. Oh, great. And someone says he tries to grow from his past experiences. Absolutely, which we all should aspire to do, right? We should all aspire to learn and grow each day. Yeah, I couldn't run a 5K. No, I could walk a 5K, but I could definitely not run a 5K. So definitely a lot going on for Marcus. So we do see a lot of challenges as well. Where do you typically see challenges for the people that you're supporting who are aging with mental health conditions? Again, I'm using these wellness dimensions. You could use those as examples, or you could put other areas. More symptoms. Yeah, and that's challenging. And the type of symptoms that people experience, again, from a research perspective, tends to be more of like a negative affect, they call it, where someone is more withdrawn or isolated, or they don't experience pleasure. A lot of these the fancy words for all of those things is like amotivation and anhedonia, things like that. We are more likely to see that as people get older, and we may see some other aging related issues like mild cognitive impairment or forgetting things or having a harder time focusing and concentrating. I see also people are putting lack of access to resources. If there's no family, absolutely. In the physical domain, absolutely. Isolation, discrimination, and stigma, absolutely. And death and loss of natural supports, absolutely. So there's, challenges in the social domain, in the emotional domain, in the financial and environmental. The changes create a constant change and loss and need to readjust. Yeah, this flexibility in thinking, we talked about that a little bit last time in positive aging. It's really predictive, when people can't sort of not roll with the punches exactly, because that feels a little too negative, and we're talking about positive psychology and psychiatric rehabilitation, but when someone can adapt, when someone can adjust to these significant changes that are occurring, there's some evidence actually that sometimes for people with disabilities, because they've lived with disabilities for a long time, they may be better at adjusting in older age. I'm thinking about some work that was done. I think it was in the state of Washington. It's been a long time since I heard these presentations. I don't recall. But on the other hand, it may be make it worse, particularly if someone has depression or has experiences depression. It might be harder. Maintaining housing, home safety for sure, and not necessarily understanding. So someone, yes, oh, thank you for bringing that up. Someone brought up this issue of hearing voices, but it's really a urinary tract infection. And that's a really common physical problem for people who age, urinary tract infections. And yet, what happens as we get older, it has cognitive impact. And clearly, it has emotional impact on people who have who hear voices. So definitely, if someone suddenly their symptoms get significantly worse very abruptly, it may be a physical health problem, and that may be actually delirium, which is having that cognitive sudden shift related to a health condition. Yeah. Okay. Well, thank you, everybody. You've done some great things. I think there's also some developmental challenges. I think that people feel, in the U.S. we're not so supportive of getting older. We're kind of a youth culture, and I think that plays a part for older adults who are living with mental health conditions as well. So making sure that people feel that they can make changes in their own lives, really, really important. Yeah, the challenge with the thing about schizophrenia is that there is a small body of evidence that suggests that there is schizophrenia can be developed in older adulthood. Now, we could argue back and forth, but that's in the literature. It's out there. Most of the people that I've worked with have had schizophrenia and were diagnosed in their 20s or teens. So I'm not so familiar with that so-called late onset schizophrenia, but there is some literature out there that talks about it. But let's talk about how we can help. We can listen. We can understand how someone is doing and ask them questions about their perspectives on aging, about their hopes and dreams, about their preferences and choice. And also give them the time and space to tell you about themselves. And I think that's, we do that. We're probably experts at that. And it may take a little more time, We also want to ask people to explore their sense of purpose and meaning, because that's literally, some of these are kind of end of life conversations that may take place. You may be working with people who are experiencing cancer or other really sort of difficult medical diagnoses, that people have to sort of work through some of this, and they may need referrals for counselors or something like that. We also want to encourage these social connections, which we'll talk a little bit more about in a few minutes. And we want people to connect to the resources that they have or have access to. Another way that we can encourage strengths is to keep mental health recovery in our perspectives when we support others. We talked a little bit about mental health recovery in the first session. And as a reminder, it's basically just this idea of people growing beyond the illness. And the challenge with the idea of recovery is that, I know I thought early in my career, and I've seen a lot of family members think that if you take that pill immediately, you no longer have that disease, or the disease is completely under control. And when we think about like diabetes, we used to talk about in mental health a lot, but it's just like diabetes. If you take your insulin every day, your mental health symptoms will be managed. So if you take your medication every day for your mental health condition, your mental health condition can be sort of on hold. But what we know now, and there's so much literature to support this idea, that it's not, medication alone is not enough. People have to want to change. People need additional supports to change. People need to sort of work through the process of that loss of who they were, who they wanted to be. And I think that a next phase, and all of you are clearly pioneers in this area, we need to be thinking about what recovery looks like for people aging with mental health conditions. Because as you put in the chat, people may get very sick physically with a UTI or other health conditions, then their symptoms get worse, and then they get treated for the physical health problem, and then the physical health problem begins to clear up, and then their mental health improves. And so that's a form of recovery as well. So we may need to be thinking more about what recovery looks like. Even what does recovery look like for people with mild cognitive impairment, or people with schizophrenia or bipolar disorder, or who other mental health conditions they've had a long time, who develop things like frontal temporal dementia or Alzheimer's or vascular dementia. So these are questions. I think the field is still young, and we still have a lot of opportunities to be thinking about how we focus on recovery. So one person who's thought a little bit about this is a researcher, Daly. He's, I believe, from the United Kingdom. He wrote a great paper on recovery in older adults, and he really thought that we should be encouraging people to reflect on the impact that mental health had on their lives and identity in the past and in the present. What is it, how has that changed? What is it now? Also, really thinking about personal responsibility and encouraging it, and kind of pushing back against that institutional thinking where it's sort of like, we can't do anything because the housing provider, because the partial program or the group system or whatever is telling us what to do. So it's how do you break free of some of those challenges? Also encouraging people to find and use their coping skills that they prefer, that work for them now, and managing physical health, because physical health is really the foundation of emotional health for everyone. And it's so much more complicated when you've lived with a mental health condition for a long time. Yeah, supportive housing with a case manager on site every day. That would be a great model. In fact, there is some literature. I'm trying to remember where I've seen it, but some recent literature and some information about considerations for supportive housing for older adults and people who may have used substances in the past may have to look a little bit different. We may have to adjust some of our current systems to look a little bit differently. We want to build those strengths. We are so compassionate and caring and focused on helping people recover and live and age well. To build strengths, we want to maintain hope as best we can that things can and do change every day, including people. Also, thinking about strengths, calling those strengths out. Wow, that you have the best sense of humor. That's amazing. And focusing on resilience. In the stories that I offered you, you all had some great examples of the strengths that you saw. And I'm sure you do that with your clients every day, or the people that you serve, where you call them out and you say, wow, what I really admire about you is you are an amazing advocate for yourself, or you're an amazing advocate for the people around you. Also, recognizing and acknowledging past successes in overcoming adversity, knowing that this idea of post-traumatic growth, that people have been through some hard stuff, and yet here they are, and they're still showing up, and they're still asking questions. Maybe they're still painting, maybe they're still reading, maybe they're still listening to music or making music. All the things that sort of make us who we are, they're still doing these things despite the difficulties they may have had in the past. Yes, absolutely. You can ask people these questions because sometimes it's about the skills that people have used in the past. And that can be a springboard for where they might want to go in the future or build on those. People have maintained really difficult health issues over time. It may be things like hepatitis or HIV, trauma, a lot of medications. They also probably know themselves pretty well at this stage, if they're in their 50s, 60s, 70s, and really growing through the challenges that they've experienced. Now, the next slide, I'm doing some work with, as I mentioned, with Academy of Peer Services, and one of the older peers, he's a peer, Carl Blumenthal. He talks about moving, grooving, and living life. And I have to give him full credit. I did not come up with this, but I thought that's what we want from people. We want them to move and groove and live life and have fun. And you would be surprised at how many pictures in online you can find if you put in older adult and disco, because this is what I found. So, just thinking that's probably kind of, when you think about age appropriate, people who are in their 60s or 70s now were definitely doing, alive in the 1970s. All right, that's my attempt at humor. So there you go. All right, so you all probably have some great ideas about how you engage people. And just some things from the literature that pop up, learn about people's values. There's some great things online you can find about value exploration, what's important, family, friends, hard work, honesty. What are the things that really drive a person? And there's some great things you can search if you do values, like card sorting things and things like that. Also encouraging and promoting self-direction, so that people feel more engaged in their life, in their services, in sort of where they're going with things, so that they're not basically being taken care of, and they're not we're not sort of making all the decisions for everyone, but we're really sort of helping them feel engaged. We also need to tailor our approaches, and I think all of you, more than anyone, are very familiar with how to tailor those approaches to the person's individual needs and strengths. And that can be a challenge sometimes, particularly if you have to, in our system, I'm just thinking about some of the providers I've talked to here, that, they have to get a goal on, in the chart within so many days. And it may take people a little bit longer to get there. And we're going to talk about that in a second, some strategies. But those are really great ways to kind of engage. How do you engage people? If you want to drop in the chat, I haven't heard from you in a little bit. What are some ways that you engage older adults when you work with them? Are there specific strategies you use? Just talking. Absolutely. Absolutely. I found some great examples of a question. Who are you at this particular phase in your life? I mean, it sounds a little bit, who are you? But, it's kind of also interesting. Who are you right now? What does it mean for you to be 55 or 75 or 68? Those are other great ways to ask these open-ended questions, to really talk to people and learn what's important to them and how they want to go forward. So let's talk about some of the strategies for engagement and motivation from the literature. We're going to talk about 3 different ways to connect, using shared decision making, which we talked about last time, goal setting, and also advocacy. Yes, and so someone is actually in the chat offering that they have had an arthritis or a health condition since they were a young person, and they actually use that to dialogue with their clients. And I think that's a great example of using ourselves to engage with people, so that people don't feel that it's one way, that you're not giving anything of yourself, because that relationship is sometimes really important, so that people know who you are and what are you bringing to this conversation. Listening to stories, telling recipes or hobbies. Absolutely. I remember a really powerful moment with someone when I was doing some work at the state psychiatric hospital. I went on the unit, and there was somebody who never talked. And I said, "Oh, hey, what's for lunch?" And they said, "Oh, it's meatloaf." And I said, "Oh, how do you make your meatloaf?" "Well, this, that, and the other." And I said, "Oh, do you put ketchup?" "Oh, I never put ketchup." And it was like, okay, we were off to the races. I learned a lot more about that person, and they were much more engaged and lively than I had seen them previously. At a potluck, nice, absolutely. Food is always often a way to connect with people. So shared decision making, we talked about last time. I'm not going to talk too much about it today. The concept really grew out of evidence-based medicine in England, and it's a conversation between someone and their healthcare provider using a systematic process and some tools. It's slowly catching on. I'm excited to see that SAMHSA has some tools and some videos that you can check out, which I think are in the reference section. Shared decision making helps with very complex decisions. If you think about any of the decisions that the clients that you serve have had to make, or even your own healthcare decisions, it can be quite challenging. And shared decision making is really not that I make the decision for someone, it's that I talk with someone to learn about their perspectives, their preferences, their choices, and then we talk together about the pros and the cons of each of those choices, and they get to rank the choices, and then they make a decision based on that. I like it because it's sort of step by step, and when I'm learning something new, I really like the 1, 2, 3, 4s. So the Ottawa decision making guide is something that I really, really like. But definitely check out, if you want to learn more about that, you can check out shared decision making, search online, or you can watch our session from last week. Now we're going to talk about something a lot of fun, which is goal setting. And that's really a fundamental task of psychiatric rehabilitation. Goal setting does increase motivation and even memory recall in older adults. That's what some of the research suggests. So there are a lot of different ways to help people set goals, establish new habits and practices. And that kind of creates a schedule for or an order so for the day to kind of get up and have sort of a plan. In my experience, helping older adults set goals does take more time, and it requires a little more structure and organization. Oh, great. Oh, somebody's already mentioned. Woo, SMART. Hold on to that thought, SMART. We're going to get to SMART. That's great. I'm really glad to hear that. Anything else that you all use to help people set goals? There are a lot of different ways to do it. Some people like to just have conversations. Other people have the forms that they have to use. Oh, the goal attainment scale. Ooh, fancy. That's great. That's wonderful. That's a really cool measure. I haven't seen that. There's a lot of literature about how goal setting and measuring your success about goals, it's really motivating. It's really motivating. And I think the challenge I've heard, at least feedback peers have told me, they have said, Michelle, when we talk about goal setting, our eyes go like sideways, because at every mental health, everything, hospitals, housing providers, outpatient programs, everything, people have to have goals. So other ways to think about it would be, things that you aspire to, things that are important to you. Consider the language that you use, because people may be really turned off by goal setting. I've been told that anyway. I've gotten that feedback. And family involvement, very nice. And being realistic about the goals, absolutely. We always I used to give the example of, someone may say they want to be the president one day, and it's like, okay, that's a great goal. What about being the president is really important for you? And when you ask it in that way, instead of, you could never be the president. What are you talking about? You're too old or whatever. You don't have any anyway. You could say, and you probably do this every day, things like, what is it about being the president that's so interesting for you? And the person would be like, well, I want to, I want to be respected. I want to be on TV. I want, they may give you other things. And then you can say, well, it's like rehab. We often say, let's take the big thing and we chunk it down into the smallest thing. Okay, well, let's start with, you want to be on TV. Wow, that's an interesting thing to want to aspire to. Let's work towards that. What do you need to be on TV? Well, okay, you probably need to try to have a fancy hairdo. Maybe you need to know people in the business. Maybe you need a nice jacket. So you really break it down into these very concrete steps that help people, sort of one step at a time, and also making it small, because particularly for older adults, I think it's important to get some success so that people feel a sense of confidence and efficacy in trying to do the things that they want to do. So, some strategies that come from the literature, but also from my own experience, offering choices. So, again, we want people to be realistic in their goal, but also have it be their goal. A lot of times when I've done work in hospitals, you know, the goal was to be discharged. And absolutely. But a lot of times what would end up on a person's notes would be the goal was to attend groups regularly. Well, said no one ever, really. I mean, I don't know. Most people don't want, that's not my goal to attend my group or, whatever. So I think it's important to really know what the person might want. And that's where you do the values exploration and you talk with the person, you get to know them. And I know you do have to work within your system of care and how are you going to get reimbursed and billable services. But how can you reframe or shape some of those bigger goals of the person to the smallest thing that may have relevance both to the billing world and to the person? Also offering visual cues. Let me go back to offer choices. Offering choices is important because people who are aging with mental health conditions may have some issues with focus, concentration, and making decisions, right? And that may be as a result of their medication. It may be as a result of the aging process. It may be a result of the mental health condition or all of the above. So I know that offering 2 to 3 or 3 to 4 choices sometimes is easier than asking an open-ended question, which is, I'll show you in a moment what I mean by all of this, of offering choices that may mean something for the person. Using visual cues, again, very helpful for people who may have not be able to read very well, have low literacy, or again, some of that processing problems of not really understanding. Visual cues can be really helpful. And I don't know about you all, I'm a super visual learner. Like I learn much better when I see things rather than if I see a lot of words, I get like, I don't know these words. Also taking your time, going slowly, not rushing the process as much as we can. And someone is already put in SMART, which is great, which we'll talk about in a second. And then the other one, WHOOP. I started talking about this on the first session, and I hadn't done all my prep for this session, so I'm prepared to talk about whooping your life. So I'm excited about that. So let me show you a sample of something I have used in my illness management and recovery groups with older adults, inpatient. And basically this technique is sort of a version of an adapted motivational interviewing sort of technique. It's helpful when people are having difficulty focusing, or if you ask them an opening question, it just feels too difficult to come up with an answer because it's like a word finding problem, maybe a focus and concentration problem. So I've used sheets like this. Now I just chose these thinking through some of the wellness dimensions of strengths and challenges. So like asking the person, what is most important to you right now? Friends, helping others, my health, feeling happy. And then I leave a blank bubble, right? You could add anything in these bubbles. And it may be, as you know the person, it may be what area is most important to you. It might be getting my cat back. It might be reconnecting with my sister. It can be as personalized as you want it to be. And you can, just do it on a piece of paper, but it may be helpful to give some direction and focus for people. And of course, it has to be what the person really wants. Then you can ask the person, what area would you like to explore with me? Or maybe however you would say it. I want to give you some examples of goals that came out of the IMR group that I co-facilitated many years ago. People wanted to learn to read. They wanted to attend and participate in volunteer events. They wanted to get a job as a dishwasher. They wanted to find a girlfriend, control their anger, or decrease level of supervision. And that was at the hospital. So they basically wanted more freedom. So I encourage you to try thinking about this. Have you used any of these kind of tools for goal setting or making before? Drop that in the chat. I'd love to hear from you if you use goal setting worksheets. SMART goals. Someone has already mentioned these. I imagine that of all of this, you're familiar with SMART. And I liked this. This is adapted from something that came out of the VA, and it's been used by many mental health agencies to construct goals. It's very clear and detailed, specific. What do you want to do and why? What do you need? And what are your assets and resources for this? The manageable, how much time are you going to spend on this? How will you know you've progressed? Well, that's hard to say. How will you know when you reached your goal? Like what's the benchmark? And some of them are going to be clearer than others, but also what actions are needed to take towards that goal. And the realistic part, really interesting. Look at these questions. Is the goal worth it? Does it line up with your values? What do you have what you need right now to reach that goal? And that might be, you know, if someone wants to live in an apartment by themselves, maybe that's going to be challenged by not having the finances to be able to do that, or they may not be able to do some of the activities of daily living that are needed to live on their own. So helping people really think through that. Is it doable? And then the timing. How long do you think that this will take? I've been told by Susan Gingrich, who one of the creators of Illness Management Recovery, she really encouraged me to think about setting goals for older adults in 30-day increments. What do you want to try to do in 30 days? Because anything beyond 30 days feels too far and a little too undoable. So that's one additional strategy to consider, is to make the goals, you know, very modest and within 30 days, because we want people to feel success. We want people to move forward, and they can build on all of these small steps and goals onto the next thing. So I'm giving you kind of a quick example here. I don't think we're going to go through it, but this is back to our friend Sylvia, who wants to lose 10 pounds now. And it's pretty easy to make this goal manageable and action-oriented, realistic, and timing. So there are a lot of resources that Sylvia could use in this example. She wants to lose 10 pounds because her blood pressure is higher, and she walks most days, and her friends support her, but she loves cooking and eating fried foods. I mean, I do too. Who doesn't? But her building has a dietitian and comes in once a month, and they're healthy cooking classes. So you can kind of see how you might go through, how can you make this, help Sylvia make this goal manageable? Like in 30 days, what might be reasonable for someone to work on a weight loss goal? You know, you could talk to the dietitian in that agency. You could think about it for yourself. And of course, for something like that, you want to start a little bit modestly, you know, like, you know, 2 pounds in a month is probably a realistic goal for someone who's older, who is active but not super active, and encouraging people to take those actions to meet their goals. The other strategy that we've talked about it, and someone has put in the 30-60-90 lets you see growth and success. I'm not sure I'm familiar with the 30-60-90. If you want to clarify that for us, if that's a way to set goals or something like that. And you have a great suggestion of what are the unhealthy foods she could do without easily, and if exercise is possible. Yes, absolutely. And looking at some of those health behavior change strategies, often it's easier to add a good thing than take away a bad thing. So like, could she cut in half, you know, reduce her portion size of fried food, but then add, you know, a salad or something like that, or add some additional walking with her friend. Oh, what have you accomplished at 30? Are you on track at 60? Will you finish this goal on time at 90? Do you need to modify the deadline? Okay. All right, that's great. I hadn't heard of that. I'm assuming 30, 60, 90 days. So that's great. Thank you so much for sharing that. Another strategy that I've been thinking more about, this comes out of the positive psychology literature, is wish outcome obstacle, because obstacles twice, I'm sorry, and plan. So that's WHOOP. The WHOOP is the fancy name, the scientific name is mental contrasting with implementation intentions. And the idea is you think about your obstacle and you make a plan around it, which it's been used in a variety of groups, including people with depression to get more active and engaged in their lives, and people who felt stuck in their past experiences. It's European. You definitely check out Whoop My Life. It's fun to say, but also you can get this great toolkit, including this is the one glance, but they have all of the different cards and worksheets are completely free. And I think it's also got an app that's new. It has an app for one's phone that you can track your wishes and motivate to go to the next step. WHOOP is a 4-step strategy to increase motivation and change behavior that uses obstacles as those kind of motivations. So it's, it's a lot of fun to sort of think about. And then I came up with a WHOOP for Marcus, the person that we talked about earlier. Our advocate, Marcus, he's busy in his life helping others and making a difference in the world. He comes to you and says he's been feeling down recently. And while he's talking to his mental health team and going to extra NA meetings, he realizes he wants to take some additional actions to experience more joy in his life. So when you think about the wish, it's like, what do you want to do? What do you hope? What's your hope in a way, your wish? And so for Marcus, I wrote, experience more joy in my life. And the outcome would be to feel more positive. And the obstacle is he feels self-critical about himself, that he's not doing enough. And then his plan, if I'm self-critical, then I will remind myself of my strengths and take a run. So trying to build on the strengths that Marcus has and making sure that that wish is first and foremost. We can also, has anyone used Whoop before? If you could put that in the chat, if you have used any of these tools. I know some of you have used Smart. Did anyone try Whoop before? Thank you. Someone says that these are good tools for sure. And I think they're helpful from a provider perspective and also for ourselves. If you want to work on some kind of a goal for oneself, it's a way to self-coach on health behaviors or anything that you want to change in your life, any wish that you might have. All right. So we are also going to talk a little bit about advocacy, about people aging with mental health conditions and how we can make their lives more meaningful. We need everyone. We need all of you. We need all of us to make things better for this group. Everyone counts. I think we talked a little bit about this already in terms of billing and reimbursement. That was the thing that I talked about earlier, that we need to make sure that funding covers the types of services that people need, whether that's substance use or inpatient or outpatient or other kinds of supports. We also really need to think about these specialized services that can handle people with many comorbid conditions, mental health and physical health conditions that may need additional extra support. I think about, I don't know if anyone here has ever worked in the system of children's care, but there are these models of wraparound services. And there are some models like that for older adults to prevent nursing home usage. And I think that people with mental health conditions are at greater risk for institutionalization in nursing homes. So definitely, what can we do? So there are some models that exist, but they're not, sometimes if someone receives services in, say, supportive housing, they may not be eligible for these long-term wraparound services to keep people out of nursing homes. So I think that as a system, we have to look a little bit differently about how the system and services meet the needs of our clients. We have to think about ageism that occurs in our programs, our services, even in our staff. Thank you. Someone has popped in. They found a YouTube, what is Whoop? And if you look up Whoop My Life .org, they have some nice videos as well there. We also want to create age positive places and spaces where we value in mental health care and services people who are aging. We also can help people think about and locate and access their preferred resources. So people may prefer to have faith-based services. They may prefer not to have faith-based services, or they may prefer to have financial services. I'm thinking like entitlements that are related to their age, but not to their mental health condition. So understanding what feels right for the person. Oh, thank you. And someone else has dropped in where you can download the Whoop kit. Thank you. You all are amazing. This is a great group here. And of course, billing and reimbursement. Is there any other advocacy? Because I know that you all have done some amazing work with this group. In what ways are you already advocating for people aging with mental health conditions? If you want to drop that in the chat, how are you advocating for people? And that might be making sure that they qualify for transportation, even though they're not at the cutoff age of 65. It might mean that they need that sort of level of housing between living on your own and a senior high rise and a nursing home, which we call here an assisted living, or personal care home is sometimes referred to in other states. But those systems don't want clients who have a history of mental health conditions, and maybe it's an advocacy in that way. So any way that you feel that you're advocating now, I'd love to hear. It could also be advocating for the person. We haven't talked about exploitation or sort of the challenges that might come up with people being financially or abused in other ways. We may have to advocate with adult protective services to look in on the person and ensure their safety. What are any other ways that you're advocating for your clients at this time? And that's something that we'll have to continue to think about, is how do we advocate to make sure that people are living the best life they can, that they're getting the services they need, and living the life that they want. Very nice. Yeah. So working is basically advocating with the person to sort of make sure that they know that you're there for them and that you want to build a relationship with them, whether or not they hear voices, and to try to work on those hearing voices. Absolutely. Really important point. And then building motivation. We've been talking about that sort of all throughout today, like knowing what someone's strengths and challenges are, but really sort of having that relationship, that engagement, that trust and patience, I think, is really key when we help people who are aging with mental health conditions. Trying to switch that I can't to that I can. Exploring interests and values. Also, peer provided services are so important. Offering, finding what those are and linking people to them. And I know, as I mentioned previously, that sometimes the peer providers themselves aren't always comfortable working with older adults. If they're, the peer provider is in their 30s, do they really want to work with somebody who's in their 60s? So maybe that is building the capacity for peers who are older to work with their peers who are also older. Yeah, wow. And you've done a great job engaging. I see a great example of someone who's been engaged, who lives in the woods, who doesn't take medications, but still trusts you enough to come and connect with you. Thank you for sharing that. That's a powerful example of engagement and trust. And having a peer support specialist, it really, I think it makes the difference for a lot of people. Motivational interviewing is very effective. We talked a little bit about that last time as well. maybe you're familiar with that, but it's a way to engage people and encourage them to think about ways they can change. It is effective in older adults. Are a few studies that have looked at the use of motivational interviewing, but you do have to adapt it somewhat. Some ways you may have to go at a slower pace. You may have to repeat a few times what you've said. However, it should be noted that if someone has memory loss, it may not be as effective because you're asking people to sort of recall certain events in their life. So that might not be the best technique if someone has age-related memory loss. And of course, staying in that recovery orientation where you're engaging the person, you believe in them, and you're helping them move forward. Can also be too painful for people to remember their past. Absolutely. If they've experienced a lot of difficult events, that can be really traumatizing. We want to build resources by linking to community services, helping people with those strategies to manage day-to-day tasks so they can be as independent as possible, helping them access appropriate care, whatever that means for them, making sure they've got access to their financial entitlements. Housing supports are where they need to be at, and building that natural support system. This is a great visual from the World Health Organization that focuses on social isolation and loneliness, which are big causes. It's really linked, social isolation and loneliness is linked to depression. It's also linked to cognitive decline, premature death, and multiple health conditions. So anything we can do to support social support is really, really important, including, encouraging contact, either face-to-face or digitally, having those age-friendly environments so people can get out of their house and have the transportation they need and do things in the community. And also the laws and policies that foster social connections. So I'm going to skip forward and ask you, where do you want to go from here? What else do you want to learn? What else do you need to learn? Someone has put in the chat about Meals on Wheels is a great resource about that. So I'm going to stop here. I want to thank everyone so much for your participation. This has been a fabulous series, and I really enjoyed talking with you. And at this point, feel free to drop questions in the chat. I'll try to respond in the chat, and I'm going to turn it over to Kati.
Thank you, Dr. Zepner, for providing us with the wealth of information on this very needed topic. As Dr. Zegner has mentioned, I will conclude our presentation today, our webinar, just to provide you a few links and information. On your screen, you'll see a slide containing our QR code. Please feel free to hover over and scan the QR code, or you can also click the link that I provided in the chat. It's our short evaluation survey. As part of our funding, we are required to evaluate all of our products and services, as well as our training events. And we use this feedback to improve and inform our future events. So next slide, please. And also, we have a podcast program toward wellness and recovery. That is the title of our podcast channel. And currently we are featuring Flourishing at Work, a plan for helping professionals. And you can find our podcast either on Spotify, Apple Music, or Podbean. Next slide, please. And if you've missed any of our webinars or recordings, or if you're looking for slides, please feel free to browse our catalog of products. And you can access that by hovering over the QR code that you see on your screen as well. It's also included on our website, and it's under the link products. And then Dr. Zechner also has these resources that we are able to share with you. And I will also share these resources when we post the slides onto our website within 7 days. Dr. Zechner, do you have any final words? One more. Certificate of completions will be emailed within 7 days. You'll receive a link to generate the certificate with your name.
Yes, thank you, everyone. I really enjoyed doing this series it's exciting to talk to people who are as excited and interested in this topic as I am. And the resources will be they're definitely available in the slide set. I encourage you to check out some of these resources. The E4 Center is another training center that focuses on behavioral health disparities in aging. So that's another great resource. The Academy of Peer Services has some really excellent trainings on all kinds of things, basic motivational interviewing skills. We also have some of that in MHTCC. SAMHSA has a wonderful resource on this as well. So I just encourage all of you to keep doing your amazing work and stay open and curious, and think about if you want to learn more. We're having a learning collaborative starting in April. Those will be a smaller group. It will be a meeting format so that you can learn how to implement and use some new programs with older adults in your setting. So if you're interested in that, you can reach out to our center at Northeast and Caribbean MHTTC for the registration link for that. And that's starting April 10th. So thanks, everybody. Have a great day.
Have a great day, everyone. Take care.